This is looking back and moving forward, lessons learned from COVID-19 isolation hotels, promoting long-term health and housing. And I think we've all learned an awful lot in the last 8 months. And we've got a really good panel here to talk about it, led by Molly Wasso Park, who's the first Deputy Commissioner of the Department of Homeless Services. Molly is one of the stars of city government, and she used to be Deputy Commissioner of Development at HPD, so she has a real focus on permanent housing, and I'm already seeing the effects of that at DHS as she moves over to the Department of Homeless Services, and so we're really glad to have her there. Simone Thompson is the Director of Shelter Services for Care for the Homeless, which is one of my favorite service providers. She's a licensed service provider with 25 years of experience. She really actually knows what she's doing here. She used to work at Covenant House. She has a Master in Affairs and Administration and a Master's of Social Work. We also are lucky to have EJ Bryant Mazowskis here, and EJ is a resident of Susan's Place, and EJ unfortunately contracted COVID-19 at the age of 80 and was moved to an isolation hotel where she recovered, and she has a lot of insight, lived experience to talk about today about her experience in the isolation hotels, and we're really happy to have her. And lastly, we have Condra Clark, who's Vice President of Policy and Strategy at Exodus Transitional Community. Exodus is a great provider that does reentry housing and shelter and with criminal justice populations. Since her release from the Beacon Correctional Facility in 2011, Condra's earned an associate's degree in criminal justice, a bachelor's in humanities and justice, and a master's in public policy and administration with a focus on urban affairs. Condra's going to share a video presentation with us, and then we're going to have presentations from each of the panelists, and then we'll have a discussion afterwards, and we'll open it up to questions for all of our viewers. And we hope to have a robust conversation about our experiences responding to COVID-19 and working in the isolation hotels. With that, I'm going to turn it over to First Deputy Commissioner Molly Park, and we'll listen to hear what she has to say.
Great. Thank you, Ted, for that very generous introduction, and thank you for having me today. It's an honor to be here. So hotels have been a very big piece of DHS's response to COVID. I think, as probably most people in the audience know, single adult shelters are largely, although certainly not exclusively, congregate settings where it's very difficult to practice social distancing. So fairly early on, we turned to commercial hotels to make sure that we were able to keep clients as safe as possible. So if we go to the next slide. So we've used commercial hotels in 4 different ways since the pandemic started in March, essentially. First, we started with isolation capacity. This is specifically for people who have tested positive for COVID or exhibiting COVID-like symptoms. At its peak, we had more than 700 beds on isolation capacity across 5 different commercial hotels. Currently, we're only using 1 hotel for isolation with about 150 beds. We feel very lucky right now that we don't need more capacity than that. So we're gonna knock on wood and hope that continues. The isolation capacity has been primarily for current DHS clients, but particularly in the spring when things were at their peak, we were also accepting referrals from a variety of other systems. So for example, as more people were getting discharged from Rikers, if somebody was self-identified or identified as experiencing homelessness and was either exhibiting symptoms or positive, they came directly to us, while other people who were released from Rikers went into other locations, which we'll hear about later. The biggest piece of our hotel component is the density reduction. Mentioned that the majority of our shelters, single adult shelters, are congregate settings. They typically have 6 to 12 people in a dorm room, and sometimes more than that. That was a situation that was really, frankly, impossible to keep safe. So we moved close to 10,000 people into 61 different hotels in about 8 weeks across from April into May. All our single adult sites are operating at reduced capacity, so either some or all of the clients have been relocated to hotels. There are a handful of clients who remain in congregate settings, but those have all been, because of our use of hotels, have been de-densified. And so we have, minimum 6 feet between beds, and other ways that we feel like we are accomplishing the density reduction. We are using commercial hotels for quarantine, so distinct from isolation. These are for clients that, as far as we know, are not COVID positive, but need to be quarantined from general population. So that could be folks who come in at intake, tested at intake, or pending test results. It could be those who have traveled out of state and are subject to the governor's executive order about quarantine for travelers, and not listed here, but also true, people who are identified as contacts through the DOHMH test and trace program. So we can quarantine people, and that can be for as long as 2 weeks. For people who don't want to get tested, we do encourage people to get tested. So for example, the people who are tested at intake may come out of quarantine in a couple of days if their tests come back negative. And then we are using, we have about 300 beds in 3 hotels that we're using as stabilization beds. These are clients experiencing unsheltered homelessness. This is sort of and isn't a COVID specific program. The services are not as distinctly COVID related as isolation or quarantine, but we did make a very significant ramp up in our stabilization capacity in response to the subway shutdowns, which certainly are COVID related. So I do count the stabilization beds here as part of our COVID response. I do want to just point out that we have a lot of additional stabilization beds in non-hotel settings. You may have heard that the total amount of stabilization bed capacity that we've added is over 1,100 beds. And then this, just to put this in a little bit more context, this is specifically our COVID-related hotel use. DHS is pre-COVID and currently in about 70 hotels separate and apart from these. These are largely sites that the agency entered into in like 2016, 2017 as the DHS census grew fairly rapidly, and we needed excess capacity in order to meet the legal mandates to provide shelter both to single adults and to families with children. It is part of the Turning the Tide plan that will be out of those sites by 2023. And we remain committed to that goal. So despite the fact that we did add a lot of hotel usage during COVID and continue to use it, we are still planning to reduce our hotel use over the longer term. That 70 that I mentioned is down from a high point of about 92. Next slide. Hotels have really been, to a large extent, a very major blessing that I think has allowed us to serve clients in a much better way than we would have otherwise. I think the social distancing that's possible in hotels has played a really major role in helping keep clients and staff as safe as possible during the pandemic. We are doing testing on a regular basis in the single adult and adult family system, where we offer tests to all the clients in those systems about once a month. Positivity rate from the most recent round of testing is about 0.4%. It has crept up very slightly in the couple of weeks since I made this slide, but we're still holding steady at about 0.5%. So that's obviously significantly lower than the citywide average. And I do think that our ability to use commercial hotels and to keep people socially distant from one another has been a really incredibly important piece of that that ability. It hasn't been an entirely straightforward process, though, to use hotels. I think, we certainly acknowledge that there are challenges. I think big one is that it is, the same way that the different kind of real estate is an advantage in the age of COVID. It's also, there presents some challenges. Hotels in New York are typically tall buildings with many access points, difficult to operate, harder to operate than a traditional setting. For providers who are in hotels, all the providers who are in hotels, we've added staff so that they are able to keep doing that. I think for anybody who reads the newspaper, it will not surprise you in the least to know that we've encountered a lot of NIMBY. We are in neighborhoods that we have not been in before, and that has been certainly a real challenge. And then while we really set out to locate as many hotels as possible near the original shelter, just given the distribution of where hotels are and our need to make sure that we had the right number of rooms and hotels that were willing to participate. We haven't always been able to keep the hotels near the home shelters, and that has disconnected people from their neighborhood-based services that they were accessing previously. Next slide. I'm going to wrap up quickly because I know I'm at time. Looking forward, we are guided by science and working really closely with Department of Health and Mental Hygiene to determine when and how we can return to shelter safely. At the end of September, the state released guidance on shelter operation that called on all localities who were using hotels to provide a plan for transitioning out of hotels. We submitted the plan as they required. It's been under review since mid-October. But our goal, our intent is absolutely to continue to protect the health and well-being of clients and staff. We are not starting movement back to hotels at this point. And both the state guidance and any other health guidance, right, is a requirement for 6 feet between beds, as opposed to typical OTDA guidance that there needs to be 3 feet between beds. So, just doing the math, I think it is relatively safe to say that we will have a hotel presence for some time to come. So I think I have just slid under my assigned 7 minutes, and I'm going to stop talking.
All right, thank you, Molly. And our next panelist is Simone Thompson from Care for the Homeless. And Simone, why don't you tell us a little bit, and E.J. Bryant-Mazowskis will also join her. And why don't you tell us a little bit about your experience with Care for the Homeless in the hotels?
Hello, everyone. So Care for the Homeless runs 2 shelters for women, and we moved 320 women into 3 hotels. There are some challenges with the hotel, like Molly mentioned, including the layout is it's much larger space in terms of just high rises, et cetera, something that we did not have in our shelters. So monitoring and making sure that we know what's going on, especially with some of the clients who may have significant mental health issues, medical issues, or substance abuse issues, to make sure that we are monitoring any concerns related to that. Like Molly mentioned, moving to the hotels did allow us to reduce for Care for the Homeless the number of clients who were becoming positive with COVID, because our shelters are fairly large dormitory setting, and the hotels allowed them to be in much more private spaces. So we were able to limit the engagement between clients and reduce the number of clients who we've had who have tested positive. From the beginning of the pandemic till now, before we went to the hotel, we did have quite a bit of clients test positive. And in the last couple of months with DHS testing regularly on site, we have not had a lot of clients who've tested positive for COVID. Monitoring, like I said, has been one of the biggest challenges because we do have clients with significant needs, and we do, as a staff, we do have to make sure that we are doing a lot more rigorous rounds throughout the facility and checking on clients who we have concerns about. In the past, they shared spaces, so there were a lot more activities in the dormitories, but whether it's by the other clients in the dorm or even staff, but the space and the number of rooms that we had to check on was a lot less. We have, especially the first couple of months of the pandemic, one of the challenge too was the slowdown in the number of clients who are moving out into supportive and independent living. In the beginning, everyone, supportive housing providers, et cetera, were, rightfully concerned. So we didn't see a lot of movement. They were not meeting with clients so we could move them out. But in the last 3 months or so, we've seen a significant uptick in the number of clients that are moving out. Supportive housing providers have started doing a lot more intake since then. Another challenge I would say is that we do have some clients who are being significantly more picky in terms of maybe in the past they would have taken an SRO, but the hotel environment kind of is similar to that. So they would probably, some of them have chosen to turn down housing and perhaps stay in the hotel setting instead of taking those type of housing, which is a concern because we're still sheltering. We'd like to see them move out of the shelter system. For those who don't know, for all the clients that we serve, all the services that we provide for the most part have moved with the clients to the hotels. I would say the only services that have not moved are the services that may have a lot of group engagement because, again, that was, COVID presents a challenge with doing group activities. So other than group activities that provided a lot of social engagement, everything else moved with them. That being said, I would say another challenge is the isolation that many clients are feeling in some of these hotel settings because as you can imagine, we're discouraging too much gathering amongst the clients. We're encouraging them to kind of stay in their space so that it does present an isolating situation for clients, especially many of whom may be suffering from depression. So, we do have to try to find some creative ways to engage, but we do have to stay away from large group activities as of now. Ms. EJ, what would you like to add? Ms. EJ, you're on mute.
That would help, wouldn't it? Okay.
Yeah.
I'm sorry, you asked what would I like to add with regard to?
So, Ms. EJ, you've been in the hotels, the relocation
right.
of Susan's Place, but you've also gone to the isolation hotels related to your COVID symptom, which you shared. So I'm not sure what would you like to add that perhaps I did not mention.
I was told that perhaps talking about the experience that I had moving from isolation, etc., would be something that would be helpful. But first, I'd like to say that the services that I was receiving in the shelter have definitely gone with me to the long-term hotel placement that I have now. And it's been very important because of not just the medical pieces, but I've had great psychological support that's made a big difference in a number of things. But anyway, my experience with the isolation was challenging, let's put it that way, perhaps because it was at the very beginning of the pandemic. The kinds of systems that needed to be in place to prevent a number of the things that I experienced were not in place yet. My first experience in the isolation shelter was, how should we put it, was more funny in some ways because, for instance, we were given meals regularly, lots of food, but they were all in aluminum or metal containers, had to be heated in microwaves. And I said, okay, what should we do with this? So fortunately, I was able to get someone to bring me plastic. That said right away to me that there's something here in this with communication. The other thing I experienced had to do with communication, and that was I was called daily to check on my situation, how I was doing, what my symptoms were. But somehow the information that I was giving to the nurse did not necessarily get to the people who were in charge of operations, and that created some problems in that I was told at one point to make sure that I let the nurse know what my symptoms were. I did that, but didn't get to operations, and so it created some sort of a conflict with regard to, well, you're ready to go. I said, well, really, I'm not. Bottom line, I stayed there for 6 weeks and was still positive at the end of that. I was put into another isolation hotel because I wasn't tested before being moved from the first isolation hotel. And as I recall, excuse me, one of the major issues with the second placement that I had in isolation, again, it has to do with, I would say, people not being aware of how an isolation hotel is supposed to be run, because I was given directions to go take the bus to get tested and go to a drugstore to get my medications. That was not funny. Okay, the metal in the microwave was a bit amusing, but the experience of not being able to rely upon people knowing what was going on was again not very comfortable. Perhaps the most distressing thing for me about the second isolation hotel placement was that the room was checked off as having been cleaned. It was not. And when I spoke to someone about it, I was told, well, there's a mop, there's cleaning materials, and that I should clean it. That did not go over well with Ms. Turner, Director of Social Services at Susan's place. And from what I can tell, after I spoke to someone at the Department of Health who was calling regularly, he said, please make sure that you report state of things there. Otherwise, nothing will change. But anyway, after I spoke to that gentleman, I did make it clear to Ms. Turner, and in a couple of days, the place was closed, which was very rewarding to me. I don't know if it had to do with the fact that it really wasn't set up very well as an isolation hotel, or whether there were other things involved. But I do know that I appreciate the support that I got from Susan's place, which I understand, I think you were involved in some of them too. I know people were very distressed about the situation there that really needed to be corrected. The piece that was missing for me with regard to the isolation hotel placement in both instances had to do with testing. There was none that was done on site at the time. Had it been done the first time I was in isolation, of course, there would not have been that gap and then going back into isolation a second time. So for a total of 6 weeks, I was positive. And again, as I said, I appreciate the support that I did get. And I'm thinking that perhaps most of the issues that I encountered have been taken care of since my experiences at the very beginning of the pandemic.
Ms. CJ, do you think, many of those issues were because everybody was learning at the time? Because that, like you said, that was in April or so, exactly. Was early on. It was early on.
At the end of March, beginning of April was when I was prepared. So I think that most of them were, except with the second placement. I think a lot of it, from my perspective, a lot there had to do with people not really understanding what they were dealing with. If you know that you're supposed to keep people who are positive or sick or whatever, in a certain circumstance, you don't tell them to clean the room and take the bus to get tested. So that I think had to do not as much with it being in the beginning, but they're not having been educated or trained properly so that they understood how to deal with these situations.
Yeah, I think that's probably true for just about everything that we were all learning as we were as we were responding. Deputy Commissioner Park, do you want to say anything to EJ or Simone? Thank you very much for your presentation, guys.
Yeah, I want to say thank you. It's really helpful feedback for us, and also just acknowledge the really challenging experience that you had. I will say that we did. The end of March was and beginning of April was a really challenging moment. DHS had absolutely never run isolation capacity before. We were doing it in you mentioned phone calls from nurses. We did that only because we didn't have the PPE to be able to provide to healthcare providers to come to do something more hands-on. We had no access to testing until May when we started, right? So there was a lot.
Okay.
Absolutely a learning experience, and I'm sorry that you had the experience that you did. I'm very grateful that you recovered. It was, we stood up our first isolation capacity, I think it was March 13th. We were for better or for worse, we were the first in the city, and there were some rough beginnings. And I will certainly acknowledge that. I would also hope that, we have learned a lot in that time frame.
Thank you, Molly, and thank you both, Simone and EJ. We're going to now turn it over to Condra Clark from Exodus, who's going to introduce a brief video presentation, and then that will be followed with questions and answers with the panelists and participants on the call.
Hi, everyone. Kate Clark. I'm the Vice President of Policy and Strategy with Exodus Transitional Community. We're a preventative reentry and advocacy organization. And back in April, at kind of the height of the pandemic, we were reached out to by the Mayor's Office of Criminal Justice to see if we would be willing to operate reentry hotels for folks who are being released from incarceration due to COVID. And we've experienced a lot of challenges, coming into this because it's a MOCJ funded shelter, basically. It's not DHS funded. There's been a lot of back and forth on, getting folks vouchers and residency letters and whether our folks kind of qualify for those things. And I think overall, we've seen some really great benefits of the hotels, specifically privacy and agency. Right? As formerly incarcerated people, agency is continuously taken from us. We're often in and out of congregate settings most of our lives. And so by having that agency and that privacy, I think it's been really beneficial. And with that being said, I would like to introduce the Vice Media documentary that we recently did around COVID releases.
Rikers Island is mad crowded. You can't social distance, it's impossible.
The infection rate on Rikers Island was like 10 times higher. As a city, we needed to take a look at reducing the jail population as safely and as swiftly as possible.
But this pandemic is actually bringing freedom to some New York City inmates. Mayor de Blasio says 23 inmates who were considered a low risk to reoffend were actually released from Rikers Island and other facilities.
I had no one to help me. You dropped off at Port Authority. You got to fend for yourself.
If you do not have housing during COVID, then you are potentially infecting every single person who's walking past you.
We needed to very quickly act.
Well, this is my space, okay. This is my clothes. Got a little clothes. A secure place to come to, a place that's supportive, a place that's gonna help you.
As a society, as a tax-paying person, you have been investing for decades into a system that has only created more harm for your community. Housing is a human right!
Fight, fight, fight!
If you want to really make your community safe, then investing in people and providing them with the opportunities they need is actually the route to go in the long term.
And that's where the notion of the hotels came into play.
Good morning.
well, thank you.
Do you have COVID?
No, I don't.
You're going all right? Any chills, anything like that?
No chills, anything like that. I'm feeling pretty good.
All right, thank you very much.
All right, you're welcome. Thank you. This area, which probably at one time served as a lounge, has now been set up to be the transitional community service area. This was the quarantine room. It used to be the gym. And if they were found to have the symptoms, well, they would go up to their room and until the test results come back, they're quarantined.
Due to COVID-19, the infection rate was like 10 times higher on Rikers Island, and New York City needed to release as many people as possible to have less people in one place. And that's where the notion of the hotels came into play. This program has enabled us to work with correctional departments like the State Department of Correction and like the New York City Department of Correction to say, before someone is released, we are going to set them up with emergency housing so that they can immediately enter a room, take a shower, sleep in a bed, have a meal, and really just sort of settle before we begin the process of determining longer-term housing.
7-Eleven, yes. All right, thank you. My name is Nathaniel Linden. I locked up in 2017, and I spent like almost 2 years in Rikers Island. COVID struck, and he let me go like a month early. He was calling me, telling me to pack up, I'm coming here. Well, this is my space, okay. This is my clothes. Got a little clothes. It looks like a lot, but it's not. It's just that this rack is small. The TV, they provide the TV. I don't have nothing else too much. Got my little thing I'm trying to get on there. I need someone to help me with Excel and WordPerfect, stuff like that. So I'm gotta brush up my skills. So I brought my little computer. My cousin helped me with that. Sometimes when I get to like down and things are not going the way I want it, I come in here and I shut the door, turn the TV on, I could just lay in the bed and I'm on my phone, whatever. But I got a place that's at least is comfortable, it's clean, and it's mine for temporary. Even when things are not right, everything about, you can go shut your door, you can go concentrate on the things that's positive to get you out of there and lift you up, and to move on, to progress. It may not be a lot to a lot of people, but when you come from nothing, then this is like having a mansion. I felt like a normal person.
We put out a call to many of our partner organizations and said, here's what we need to do. We need to staff this up tomorrow. And Exodus was one of the organizations that said, yeah, we can. And they were there the next day.
If I was calling the HRA hotline for a week, trying to get this as a vice president, I can only imagine how frustrating it is for our residents and our participants to continuously call a number and not have anyone answer or not get any response back. Housing is a human right, and we're here to fight for that. So thank you very much. Exodus Transitional Community is a preventative reentry and advocacy organization. We currently run 3 hotels. We have about 140 people who are released from upstate prison every year, and they come into Exodus to receive our cognitive behavioral intervention therapeutic programming, as well as our job readiness programming. So the goal is always to transition them out of the hotels into more permanent housing and provide them with the opportunities and skills needed so they don't recidivate. Right now, what we're spending for detaining and incarcerating people is over $300,000 a year. And that costs a lot more compared to our nonprofit organizations. In addition to spending that, the way that we're doing it, most of those people cycle back in and out multiple times. So I think investing more in alternatives to incarceration is really important because national average is like close to 70%, while our ATI programs have very little recidivism.
Most insidious effects of incarceration is that people are separated from one another, right? And in that separation, fear can fester. So when something that has been hidden away from you is suddenly in your backyard, I think sometimes the first reaction is fear. But really, as we've seen community members interact together, spend more time with one another, we've begun to see that shift. And I think that is what needs to happen more and more. Folks need to actually see one another, get to know one another, understand one another's stories.
It gives you a sense of purpose, a sense of being, of that you can get through this. Yeah, you lost everything. Yeah, you messed up. Yeah, this and that. But someone is saying, okay, I'm gonna let you try again.
Wow, that was a great video, Condra. Really, really appreciate that. Do you want to say anything to wrap up about Exodus's experience?
Yeah, I think overall, it's been a very eye-opening experience, as some of the other panelists were talking about. In one of our hotels specifically, we did experience a lot of NIMBYism. Once they realized about 3 or 4 months after we had already been there that we were there, of course it was a problem. And we've had to be really creative, and I know DHS has done this for years in the past, but we created a community advisory board to kind of bring in the community and also provide them with more information so we could all collectively come together. And I think it's just been a really beautiful thing. I mean, one thing that we've continuously heard is we're trying to transition folks as quickly as possible because they do not want to go back to congregate shelters, especially after experiencing the hotels. So anything that we can keep doing to kind of move forward with that, and even rethinking reentry as a whole, right? I have folks who've been in shelters 4 times. And now, because they're couch surfing, they're told they need to go back to a shelter just to get the voucher, right? So if we're seeing this, and this is a common thing, especially with the reentry population, us being creative and thinking around different reentry vouchers or other different ways that we could mitigate so folks don't have to keep going back into the shelter in order to get services, I think is really important moving forward.
Simone, did you get similar experience in the differences between serving people in a congregate facility and then serving them in a hotel setting? Did you find there were differences in the way that services were delivered and how people accepted them?
I mean, I do think most people will choose a hotel setting because it provides a lot more privacy, especially in what we're dealing with a pandemic, which is pretty scary. Because the issue is we ask clients to wear a mask, we ask them to use hand sanitizer, we ask so many things that help us to protect ourselves, but on a daily basis you could only account for yourself doing those things. So I do think that the hotel setting gives a feeling of security. I'm not sure how long this could go on for, and I'm not sure how long it's going to take for enough of us to be vaccinated that we don't have this concern. But for now, I do think that it helps them to feel better about being able to help protect themselves however they can, being in this sort of environment.
What do you think, EJ? I see you're muted, but what did you think in terms of going from a congregate setting to a hotel?
I couldn't agree more with what Simone just said. One of the things that I've appreciated certainly is not just being in a hotel, but what I see as a consideration that was given to where I was placed in a hotel. I'm at the end of a corridor where there is no traffic past my room. I'm the only person in the room, so it's easy, very easy for me to isolate. Some of the residents don't quite get it yet. So I can be myself where I don't have to be concerned about being exposed to people who don't quite get it. It's much, how do you say, if there were some way that shelters could have more privacy, just in general, I think it would be better for everyone mentally, how the experience affects you, because it's a stressful situation to be in and of itself, but to then have to be concerned about getting ill, or in my case, getting ill again, because I've learned you can get reinfected. Excuse me. I'm looking forward to being out of the situation before congregate shelters, or if we go back to that.
Yeah, I can imagine that the privacy would be a big plus about the hotels, but did you feel like the isolation was that psychologically, was being isolated in hotels a problem, or how did you feel about that?
Well, I think for a number of people, perhaps it would be, but I've always enjoyed my own company. I grew up as an only child, so I'm fine. And I do stay in touch with people, in various ways, phone, text, whatever. So no, I don't feel isolated at all.
Yeah, the technology, I think the technology really helps. Molly, what do you think are the main things that DHS has learned from this? I mean, you're seeing this in so many different locations, but in the shift from shelters to hotels, what are the main lessons learned?
There are so many. I mean, I think as EJ alluded to, there's a lot of lessons learned about how to operate a healthcare program, or what is essentially a healthcare program, right? So there was, our first response was to get people who were positive or exhibiting symptoms out of congregate settings, right? We moved really, really fast, and we absolutely had to catch up with medical care to go along with that. Fully agree with that. So we learned a lot, and I certainly would do that differently in terms of how we structured the degree of medical support. I don't regret moving quickly. It was the right thing to do, but adding the medical care was also the right thing to do. I think acknowledging the NIMBY and being sort of more prepared for it as an administration, I think it's something that DHS is used to, but we took it to a whole new level, a lot of different communities and a lot of additional sites that I think was, as I say, I think DHS was relatively well prepared for it, but I think as administration, sort of gearing everybody up for that level of pushback was really challenging. And then I think we have learned a lot about what it takes to staff a different kind of layout. Simone referenced some of that. We definitely experienced some of those challenges, and for some of our providers, we've done 2, 3, 4 amendments to their contract. That is a lousy thing for everybody to have to do because it slows the process down. It's sort of all the extra bureaucracy, but as we've learned, we've adapted. So I'll leave it at that.
Condra and Simone, I mean, and you'll both jump in, but it's got to be different to deliver services to people in a congregate setting and to manage a congregate setting, and then moving the same staff and the same residents into a setting where people are largely behind closed doors, in 1 or 2 to a room. How did that change interactions between staff and residents?
I would say one of the big changes is, right now, I mean, in the regular shelter, they were able to just walk in a dorm and find a client who, they weren't able to be in touch with. Now you kind of have to be more purposeful in making sure you schedule an appointment and make sure the client is ready to receive you. I mean, I think we've learned also, there was a period where we were doing a lot of phone contact for a very short period because, again, to keep the staff safe, to keep the residents safe, there was a lot of work that had to be done to get everybody comfortable in the new space, and reminding folks that some of protecting themselves is their responsibility. I would say DHS does not get enough credit that they did move so quickly in moving us once the number of positive cases started to show up. DHS did an incredible job. Let me speak for Susan's Place, which had quite a bit of positive cases. and they moved 50% very quickly, and then they moved the other 50% when they decided we were going in that direction. But it was a matter of couple of days where they were like, hey, get ready to move. This is better for the clients if we move them into spaces, because we did have so many elderly clients. We did have clients with multiple medical and medical issues that put them at high risk. So DHS, again, oftentimes we can point out the things that they haven't done so well, but I would say even with the hiccups that we had along the way, DHS was instrumental in helping us go from having quite a bit of positive cases to zero. And it was kind of a headache at first, and we're like, oh my goodness, but in the end, it was the right decision that we were able to work with them to make it a safer space for the clients.
Yeah. Condra, do you have anything to add to that? I completely agree that it was an incredible logistical triumph by both providers and DHS staff to move so quickly. I mean, 10,000 people from one set of locations to another is not something that you can just do. And DHS and the providers really accomplished it in record time. It's unbelievable. Condra, do you have something to add to that from your experience?
We've never provided congregate setting housing. And even as we're getting ready to apply for transitional housing, that's something that just us as a justice impacted community is heavily against, is the congregate settings. And I think if you look at it from a different perspective, we have folks who just did 20 years upstate in like dorms or in congregate settings. So then to move them back into another congregate setting when they first get home, it's not the right route for our population specifically, right? So I think I can say that. And then, for staffing, and again, like I said, we've never had a congregate setting, but we've really, created a streamlined process with our staffing where our residents, we do wellness checks every day with folks 3 times a day. And folks are coming down regularly. So we have a lot of interaction with the staff and residents because we've used the lobbies of the hotels as kind of the case management setting, as you saw in the video. And we still do small group activities as well, but that's because in some of the hotels, we've had access to large conference spaces, office spaces, we've been able to be really creative. We even have an outside space at one of the hotels that's on the 3rd floor. So it's also allowed us to do some trainings, and especially when it was a little bit warmer outside, which also makes people, I think, a little bit more comfortable. So I think it also just depends on the space, right? Certain hotels, it's a lot easier for us to do that. And then other hotels, when there's not a lobby and there's not the different settings, it makes it harder. So I think what we've all been really great at doing is being really creative and working with what we've got and, trying to make the best with what we have.
Is that what you're
lines
seeing
up with
well,
with
Molly?
the DHS experience as well. Different sites offer really different kinds of amenities.
What are you hearing, Molly? What are you seeing in terms of service delivery and case management and helping people with housing searches and everything like that? What are you seeing providers experiencing, and your own DHS direct staff?
Sure. I think providers and DHS direct staff have just been heroes throughout this, because we were going in early days. There was a lot of expectations of just, mass absenteeism, that we wouldn't be able, we were talking about doomsday scenarios about how we were going to run programs on, skeleton staff, and none of that happened, right? People have stood up, they have come in, day out. Some providers have done compressed schedules or other kinds of things to help some staff stay remote, but really people have been just tremendous partners throughout this to make sure that we can continue to serve clients in the way that we want to serve them. I think Simone mentioned that permanent housing placements have certainly been a bit of a challenge during this time. I think we're hitting about 2/3 of goal most weeks. It was a little lower early on, it's a little higher now, but there's a number of reasons for that. I think people might not want to go out and look at units. We've set up a virtual viewing practice so that we can do inspections of units and other kinds of things, but you know, it's hard to go see an apartment in this environment. As was mentioned earlier, some of the supportive housing providers kind of hunkered down, I think, for a little bit. I certainly understand that concern and that instinct. We've seen those numbers pick back up, though. And so we've just been trying to get really creative about working with different kinds of partners to make sure that we are finding placement options. HPD has been a really tremendous partner throughout this, and the number of placements that we're making into HPD units is higher than it's ever been, and so that's really been a terrific, small silver lining here, but it has been challenging to get to continue to make the permanent housing connections.
Is that what you're
Can I just add?
Simone?
I was just going to piggyback on some of what Molly said. I think part of the group that is among the unsung hero are the staff that work in shelters, because working remotely was not an option for us. And we never had a day where we had a significant absentee issues. Again, concern, a little bit afraid, all of those anxieties, but people showed up every day. Even when we had quite a few positive cases at our shelter before we moved, the staff, again, concerned, trying to follow protocols, but our staff have showed up. They really were essential workers, showing up and delivering services and providing care for the clients that we serve.
Yeah, there are actually a lot of comments in the chat column, saying how important the caseworkers have been as essential workers, and really unsung essential workers within the shelter system, because really it was over, above and beyond there. Did we just lose Simone, or we just lost your video? Okay. We're gonna ease into questions from the audience. One question was just in terms of looking to the future, Molly. Are there plans to retrofit existing shelters with an eye to making them safer in terms of communicable diseases and just from a healthcare perspective, in doing anything physical, any effort to retrofit shelters now that we've gone through this pandemic?
Sure. So the OTDA guidance that we've gotten about operating back in community settings, or for the sites that are still open, as I mentioned, there are some that are operating at 50% capacity, has very specific guidance about changes to HVAC systems, and that's certainly something that we will be following. And going forward, we will, certainly also be looking at other changes. We have a vast array of different kinds of sites within the DHS shelter system. Most of them are congregate, but congregate can mean a lot of different things. Not all of the single sites are congregate. So there is definitely not a one-size-fits-all solution there. And certainly as we add new capacity, we encourage providers to think about different kinds of sites, to bring us different kinds of sites. And we do expect that we're going to continue to have an array of different options that meet different needs. We're learning from, and I think the HVAC is a perfect example, learning from COVID, but also realizing that whatever the next thing happens, it's going to be different, right? I don't know what it is, it will be different. And so I think trying to make sure that what we are doing is providing high quality, well-designed shelter that can meet a variety of different needs. I think that's the best thing that we can do.
You mentioned earlier that that DHS is not moving out of any hotels yet. You've provided a plan to OTDA, but do you envision using hotels for an extended period of time for certain populations, or on some basis? What are the plans right now?
So from a COVID perspective, I would say as long as there is a health emergency, I expect we will be in commercial hotels, at least to some degree, right? We are a creature of the state. So it certainly matters what the state says to us, but what under any circumstance, what the state has said is that there needs to be 6 feet between beds, and that effectively equates to hotel use. And that is in the context of the COVID emergency specifically. I also mentioned that we are in 70 hotels that are not COVID related, that we were in before the pandemic, and those we have a long-term plan to transition out of, but they will be a part of our portfolio for at least another couple of years, probably, some of them.
And Simone, I mean, from a provider perspective, would you want to continue to shelter people in hotels if you could?
I think as long as it continues to present a health problem for the residents, we have to look at it. I'm not sure that it needs to be a 100%. I think maybe not quite as many in the dorms that we have. I think there could be a combo, you know. I think there could be a way to reduce the number of clients that are in each room and not necessarily 100% being in hotels. But again, until it's safe for us to be back in a setting, a dormitory setting, I think we have we hope that we continue to provide safety.
Yeah.
But I do think we have to look at different designs as we're building shelters, you know, privacy barriers, creating a different sort of structure instead of a big dormitory setting. I think we've learned that it's safer.
Yeah. What about from a budgetary perspective, Molly? I mean, if you've got people 6 feet apart instead of 3 feet apart, that means fewer people are going to be able to live in one room. Is that put budgetary pressure on DHS?
Yes, there's a lot of other answers to that question, but I also think almost even more fundamentally, we have talked about NIMBY in the context of these hotels, but let's not forget the reaction that shelters get under any circumstance. Citing shelters is a tremendously challenging thing to do. And, you know, it was about my 3rd week on the job when I was at the community meeting in Maspeth that got a lot of press coverage where they threatened to burn the shelter down, right? There is a lot of very strong feelings out there, you know, to the degree that I have spent a long time in city government and a long time in the housing world, but you know, the extent of the vitriol was really surprising to me when I came to DHS. It's a real challenge. So I think before we are going to be in a place, you know, in addition to the very real budget constraints, but before we were in a place where we could talk about large scale de-densification of shelters on an ongoing basis, we as a society, as a city, needs to have a different kind of conversation about how we serve the most vulnerable citizens and how we interact as a community and what it means to have a shelter in communities. I do not have a blueprint for how we have that conversation, but I think it's a very real issue.
Yeah. Condra had talked about, you know, wouldn't it be great if we could just give people vouchers rather than sending them back to a congregate setting? And you know me, you and I have talked a lot about converting hotels into permanent housing. What kind of efforts are going on there?
I'm so glad you asked. It's one of my favorite topics, as you know.
One of mine too.
Yeah. I think there is very real potential to convert some of the hotels, financially distressed hotels, into permanent housing. I don't think it's going to be a silver bullet for the affordable housing shortage in New York City, but I think there's a real opportunity. So what we have done very recently at DHS DSS is to adapt a product that we've had for some time called Master Lease that allows not-for-profits to lease buildings and use them as permanent housing. Then they've typically been relatively short-term contracts, and the rent flows flows as tenant-based vouchers with a service overlay as opposed to as a project-based contract. So you can't really develop anything with that. What we've done lately is adapt that product so that it is a 30-year contract and the rents are paid through the contract. And I am cautiously optimistic that we're going to be able to use that so that some not-for-profits can do some hotel acquisition and convert them to permanent housing. It is 100% not going to work in every case. We had a provider, not too long ago, who brought us a hotel where the hotel owner was asking $800,000 a room as a sales price. Like, we are not acquiring that site, and that one's not a possibility. But I think there are going to be some, and I think it's going to be. I'm really hoping that this contract product that we've rolled out is going to be something that we can work with the not-for-profit community to add some housing to the universe. I think we can all acknowledge that hotel rooms in New York City are small. So this is not going to be the housing option that works for everybody. But I think, given the depth and breadth of the affordable housing shortage in New York City, if we can add some additional units and grow the pie a little bit, that would be something that we should absolutely strive to do. And I'm excited that we're working on it.
So essentially, you're going to be using vouchers to help formerly homeless people to pay the rent. You're going to use it not only to pay the rent in existing housing, but now to allow those vouchers to help finance new housing for people who are coming out of homelessness. Yeah,
I will try and avoid going too far down the housing wonk rabbit hole, but I definitely have a tendency to do that. But it's similar to other project-based contracts that have existed in other realms. So whether Congregate 1515 or project-based Section 8, I will be very clear, it is not 1515, it's not supportive housing, it's different than Section 8, but it is akin to those in that we have a contract that is attached to a building, it's there for the long term, it covers both. It has enough money in it to cover both some debt service payments and the operation of the building and some light touch social services. And because it's attached to the building, we think it can be used to leverage private financing.
Do you think that kind of, one of the issues that a lot of providers are encountering is people who are undocumented living in their shelters, and there's just very little they can do to help them find permanent housing and move to permanent housing. Are there any kinds of solutions that would be available to us for that population?
That's a really tough one. That's not a particularly satisfying answer, but unfortunately, I don't have a terribly wonderful answer right now.
And Condra, could you see a similar voucher program for people coming out of criminal justice before they get to the homeless system?
We would love to. As activists, this is something we've been talking about over the last year, especially during COVID. Specifically, like I said, I have one of my friends right now, 6 state bids, 4 times in a shelter. She's couch surfing, and DHS is saying she can't get a voucher unless she goes back to the shelter for 90 days. And she's not going back, right? She had a very bad experience the last time she was in, and it is very traumatizing for her, and she's just not going back. She's refused. We've talked, we've kind of done all that we can do, and she's choosing to stay on this couch until she can get employed and get her own apartment. And she's in her 40s, right? That's not something that we want to keep people in. I think when we're talking about the vouchers too, there's some really important intros right now that the city council is trying to push through. One is intro 146. It would actually increase the vouchers to fair market rent rate. I think that even when we're talking about folks who have vouchers, I see people who have vouchers and they have been expired. You're getting them another voucher. I had one person who's had vouchers for 5 years and has still not been able to find housing because the vouchers for a 1-bedroom are $1,265. And we know that in New York City, $1,265 doesn't really get you a 1-bedroom apartment, right? So I think that even with the current voucher system, there are things that we can change to make it move a little bit smoother. People think that once you have a voucher, you're good and you have housing, and that's not the case. I mean, we work with so many people who've had vouchers for years, and it's finding a landlord who's not going to discriminate against them, figuring out how they can pay the additional portion of their rent, right, if they're not getting other funding sources. So we would love to, you know, have a really honest discussion around how could we create a voucher system specifically for the reentry population who's been in congregate settings in and out, you know, several times. All of them have been in the shelter several times. They've all been usually in and out of the system, the incarceral system, several times.
I do want to chime in. There is a home-based program that's targeted on Rikers. It has a very specific population, but there, you know, has been work done to make vouchering somebody part of the reentry process. You know, certainly happy to have an offline conversation about what that looks like. And, you know, it's actually not even under my purview, but we can take that offline.
Yeah, we work with them. Again, it's still that, you know, there's just not enough. And during COVID, a lot of that was shut down with them being able to actually get on Rikers. So again, as we're seeing this huge influx of people coming out, none of them are qualifying for it based on timing and the pandemic as well. But yeah, we absolutely do work with SUS, and they do amazing work.
Yeah, and it's like, I mean, this is something that DHS, the homeless shelter system, is the dumping ground for all the other systems. And so it reminds me a lot of back in the 70s, which is before my time, really. It really is. Back in the 70s, the Office of Mental Health said that their job was to run psychiatric centers upstate, and they had nothing to do with housing. But advocates were able to convince them that mental health was best delivered in the community, and housing became part of OMH's responsibility. And now we have, you know, tens of thousands of supportive housing units. And I'd like to see the Department of Corrections take on the same kind of responsibility. I don't want them running the housing, but they should be taking part of the corrections budget to pay to help people re-enter the community, because that's at least as important as making them do time. EJ, from a resident perspective, are there things that we could do that would make it easier for people to move out of the shelter system and into housing?
Well, I think the first thing that comes to mind for me, Ted, is that very often when you're in a shelter, there's a feeling of a loss of agency, that you really don't, that's not very comfortable. So I think anything that could be done while residents are in shelters to increase that sense of agency, to make them feel more empowered, would be helpful long term. One of the things that I know I've discussed with one of the residents, actually had come to me about how to, while in the shelter, become better than you were before you came in. And I housing is certainly a piece, but there are other things that are important too, that you're sending someone back into the community who is better prepared to be in that community.
Yeah. We're coming to the close, but Simone, I was curious, and I see a couple of our listeners are as well, just in terms of service delivery, when people are one person, two people to a room, was there an uptick in overdoses or other kind of medical emergencies that you weren't able to respond to as quickly as you would in a congregate setting, or were you able to handle that? What was Care for the Homeless's experience there?
No, we haven't. DHS gave us, we were given extra money in our budget to increase our staffing. So we just do a lot more rounds. And, you know, on the clients that we have the most concerns about, we check on them more often. And the clients that we have, like the ones that we may have administered Narcan, things like that to before we moved, we have a few rooms that have doubles. We didn't put them in singles. We put them in rooms with another person, which again, we do a lot of rounds, but having a second person there, you know, is also useful.
Yeah, I can confirm that. But certainly done with great regularity.
Yeah, no, I think it was really important. I heard this from a number of providers, how many more staff it takes to manage a hotel with many floors and many rooms than than just a congregate shelter, and DHS did increase budgets for that. Is there a chance to increase wages as well? Because this staff has been working very hard and the budgets are tight. So it would be great if the frontline workers were also able to see increases in pay. That will help with retention and skills and keeping on experienced staff, I would think.
Yeah, I hear that. We were able to do some COVID-associated increases early on. I think it is a very fair comment. I also would say we are in a really, really tight city budget situation. You know, I'm subject to furloughs, as are as are my colleagues. You know, we've had to do some really significant cuts. I really hope that is a temporary, for many reasons, really hope that is a temporary situation, but I'm unfortunately not in a place where I can make that kind of commitment right now.
Yeah. All right, any final comments from any of the panelists? We're coming up to time now.
Can I just jump in? I had two really quick final comments. I think my first one is around kind of just what was mentioned around the budget. And I think as a city, right, the city needs to really take a good look at around reallocating funding, right? Divest and invest. And we talk about this a lot. If you look at the Department of Corrections budget, for example, there's about 4,800 people incarcerated right now. There's close to 9,000 officers. They have a 2-to-1 staff to incarcerated person ratio because that budget has not been decreased all these years, even while the need for the services have been decreased, right? And so I think, and there's quite a few budgets that you could look at that we could really think around. Housing plays an important role in all of these systems. So housing should be included in all of these different systems budgets, right? And I think if we think about it that way, we could really do some creative divest and invest strategies and reallocate funding. And then just one last thing, and I'd be remiss if I didn't say it, as a formerly incarcerated woman, it just took me 9 years coming home from prison and a current vice president to get my own 1-bedroom apartment. Again, because I was continuously discriminated against, that box on the application that asks if you've ever been convicted, when you're applying for housing, it discriminates against us, right? And even for a white woman who is a vice president, these are the things I'm experiencing. So you can only imagine what folks who are just coming home, who haven't had their education yet, who haven't, you know, kind of built up their, you know, ability to work and things like that, what they experience. So there's another intro in the city council right now. It's Intro 2047, and it's the Fair Chance for Housing Act. I'm always talking to folks to kind of reach out to your council members and see if we can pass that bill through, and that will help start to end the discrimination that we see against landlords for folks who are justice impacted. So I'll leave you with my final thoughts. Thank you.
Yeah, no, I think that's a really important point, and I've seen this administration work a lot more than any others before on source of income discrimination issues and trying to fight back on that. But it's a huge hill to climb, and it's something we all have to be aware of and keep fighting. You're absolutely right. I think that, you know, I would like to thank all our panelists. You guys have been really terrific. Thank you, Deputy Commissioner Park, and thank you, EJ and Simone, Condra. Your perspectives are really useful at this time, and I really appreciate the Health and Housing Consortium being able to present something like this, because you just don't get to hear all these voices, certainly not all together in this way, that you know, it really adds to the conversation. And I think that this has been a good education for me, certainly, and I hope for other people listening in. So I think with that, I think we can close out, and thank you all for listening in, and thank you all for participating.